I'm Gonzalez. I'm a physical therapist, and I've been a physical therapist for almost 27 years now. In my practice, I see my clients who vary from teenagers all the way to people, the oldest one I've seen was 101 years old. And these are people that have different needs, uh, ranging from difficulty in moving because they're weak, they have pain, all the way to people who want to improve their ability to perform in their chosen sport. When I first see somebody, I evaluate the whole body. Depending on what is wrong or what their reason for coming to me, I will take that into consideration but still see the entire person. I assess from head to toe because, that statement, everything is connected, it's true. Our body is connected, so that problems with the neck can affect the lower part of your body. There's such a thing called a kinetic chain of movement, and these are things that I pay attention to. Therefore, I will assess every bit of motion, and I can detect muscle imbalances through the techniques that I do, including the Kihara resistance stretching, which I use for evaluation, and I use it also for correcting the muscle imbalances. Kihara resistance stretching is a special technique that uses resistance as you are making the muscle long. And the purpose of that is to actually increase your strength as you're increasing your flexibility. How that translates to function is that you actually protect that muscle all the way to the end ranges. The importance of doing resisted stretching is that, take for example a rubber band, and if you pull a rubber band taut, just as you do like when you're doing passive stretches, you can pull it and pull it and pull it, and eventually that rubber band will give and break. Now, when you're doing eccentric resistance stretching, you're actually increasing the tensile strength of the muscle as you lengthen. That is protective to the muscle, and that also, it's protective because you increase the strength with flexibility, but it's also protective because it is going in that range under its own volition. So that's the difference between the passive stretching and the eccentric resistance stretching. So one big key to my practice is that I try to take out the snags in your muscles. Like when you find a knot on your shoulder, that interrupts the fluidity of your movement. So we want to work that out so that we can actually make that muscle long and then strengthen it. I use different things such as soft tissue mobilization, myofascial release. I also use the radial pulse shockwave or ultrasound, depending on what is necessary for that particular case. What I do is I look deeper into the problem and find the source of the pain. And if it's muscular, musculoskeletal, positional, and we can correct it, then that's how we approach the rehabilitation. I try to work on proper body alignment, increasing postural awareness, and then assisting with soft tissue techniques in order to allow the body, to give the body more freedom to move, because sometimes you can't get there yourself. Even if you tell your body, oh, I can raise my arm up, well, there's some restrictions there, so I have to work on it in order for you to be able to raise your arm. I have to facilitate that motion through soft tissue techniques or through the eccentric resistance stretching.